course, health research in the department, and we're very excited to hear from Professor Ross today. David grew up in Nigeria, Sierra Leone, and the UK. He is a clinically trained epidemiologist doing research and training on adolescent health and well-being, and is a professor extraordinary in epidemiology and public health at our institute here at Stellenbosch. From 2015 to 2020, he led the World Health Organization's work on adolescent health research and guideline development. And prior to that, he had spent 32 years on the academic staff of the LSHTM, during which he was based in Africa for 10 years in Ethiopia, Sudan, Ghana, and Tanzania. David currently lives in Germany. He's an associate editor of the Journal of Adolescent Health and is a consultant to the Child Health Initiative of the FIA Foundation, seconded to the Partnership for Maternal, Newborn, and Child Health to work on technical underpinnings for the 1.8 billion Young People for Change campaign and the Agenda for Action for Adolescents. He is also a consultant to WHO to advise on the Y-Check Adolescent Health and Wellbeing Checkups Research Program in Ghana, Tanzania, and Zimbabwe. Welcome, David.
Thanks very much. So very nice for you to tune in, and there's some various people here in the room with me as well. So I'm hoping to speak for a maximum of 40 minutes, and then there'll be some time for people to ask. I'm not going to be giving you results of a research study or anything like that in this particular talk. It's basically to just let you know about various of the global initiatives that are going on to promote adolescent health and well-being, and to put that in context of what's happening more generally in, if like, international organizations. Yes, if I can manage to get it to move. Good. Okay. So I hope everybody, well, scream if you're not seeing adolescence within the life course as the slide. So I probably don't need to talk about this much. That it's a transitional phase, rapid changes, but it also provides a second window of opportunity to influence individuals' developmental trajectories. After the early years of life, especially the first 1,000 days. And Mark and others wrote a paper about this that was published in 2019. Where was it published? Was it BMJ or somewhere, I think? Anyway, that it's an opportunity to either mitigate the effects of early adverse child experiences, and to prepare them to thrive in adulthood, or of course events that happen during adolescence. It's a sensitive period where they can exacerbate negative earlier experiences. The title included adolescent well-being. What is this? And the history of why I got it when I was working at WHO. I got a UN H6+ technical working group on adolescent health and well-being to come to think about a definition and conceptual framework for adolescent well-being. Was that the Fondation Botnar, which is a Swiss foundation particularly interested in adolescent health, came to us and said, we're planning to do to make adolescent well-being beyond just health a major focus of our work over the next time. How does WHO define well-being? And so I went online, as one does, and quickly did a search or whatever, and basically couldn't find anything. So I asked lots of people. And of course, the definition, the WHO definition of health defines health as well-being, interestingly, but never defines well-being. So we thought, okay, we better sit down. So there was got together. So the UNH6+ is UNAIDS, UNFPA, UNICEF, World Bank, WHO, and which one have I forgotten? Another one that I forgot. Who will shoot? Pardon? No, UNESCO's not part of it, though we did have it in our plus. They're part of the plus, and the World Food Programme is part of our plus. Anyway, we got together, and with a lot of consultations, like we had 8 consultations scattered across the world with young people, and we had 8 consultations, sort of multi-stakeholder type consultations, including young people, but also programmers, academics, etc., to come up with this definition. There's a short version, but because it was a committee, we had to have a long version as well. And so, yeah, that you can see up there on the slide. And perhaps more importantly, we tried to unpack, that definition of adolescent well-being. And we came up with 5 domains of adolescent well-being that vary between the individual as to which are the most important to that individual. But we thought, everybody, these 5 domains either contribute to their well-being or detract from it. So good health and optimum nutrition, the issue of connectedness, which is, if you like, your relationships with people, or with your school, or with your employer, or with society more generally. Positive values and contribution to society. The other one's blocked on my screen, but it's there it is. Safety and a supportive environment. And then, the whole area of sort of education, learning, skills, and employability for the future. And then agency and resilience. And so that's the sort of context of what we're talking about when I'm talking about adolescent well-being. So health and nutrition, if you like, is in this conceptual framework, is a part of the overall well-being, but it's not exclusive. The other things are also really important to your well-being. So in terms of where are we going in terms of adolescence and youth well-being, as everybody will know about the Sustainable Development Goals, and clearly there's been a huge progress in many of the Sustainable Development Goals, but much more needs to be done. And so, for example, looking at health specifically, there's mortality has gone down, in adolescents and youth by 22% since went down between 1950 and 2019. But those declines are much less than for infants and young children, which is more than 50% reductions. In terms of child marriage, so that's the SDG 5, the gender equality thing. Between 1995 and 2020, the child marriage decreased by 39%, so globally. But there are still pockets of the world where child marriage is common. So sub-Saharan Africa as a whole is 34% child marriage, and South Asia 28%. And when one looks at particular countries, some of them are up above 50%, in like Chad, for example, in sub-Saharan Africa. And then, again, under good health and well-being, the section SDG 3, the adolescent birth rate has decreased, even in that short period from 2015 to 2023, by 13%. So very impressive. But there's still 70,000 adolescent mothers who die each year globally. And then in terms of secondary school education, again, in that same period of, what is it, it's 8 years or something, that's increased by 5% in that 8 years. But more than 1 in 5 of global youth are NEET, so not in employment, education, or training. So there's a polycrisis and intersectional vulnerabilities that are contributing to these deficits, if you like, of well-being. And a study that was done by Lee and colleagues, it involved George Patton in 2018, looking specifically at health. It showed that adolescents have more than 10% of the global disease burden, but they only received 1.6% of development assistance for health. during that period of the first 15 years of the decade. And you can see all of these multiple different things that contribute to this, make it very obvious that a multi-sectoral approach, is essential. And this kind of sectors that one's talking about here include obviously youth. You're often a ministry of youth and sports or youth and whatever, education, health, agriculture, because of nutrition in particular, but also partially related to employment, social protection, social welfare, commerce and industry, because of, we'll see later that in the desire to be employed is one of the biggest contributors to stress, in adolescence. Am I going to be able to get a job? And then the legal and justice system, women's affairs, housing and public works. So, for example, road safety is dependent on the sort of public works area, housing in order to have decent shelter, and finance. So clearly we're going to need a multi-sectoral approach. So there was a paper that I was the first author on that came out a couple of years ago, trying to give the reasons for why increased investment in adolescents and their well-being is critical. And we came up with 4 key reasons. The first is that it's just a basic duty of governments, from a human rights perspective, that all of your population, and one can argue that adolescents need extra investment relative to, for example, a 40-year-old, because they're still developing and they're the future of your nation. They need education, they need training, etc. But it's a duty of governments to provide that to their population. The second reason, and I'll go into a little bit more detail on this in a moment, is the demographic and epidemiological transition that's happening globally. But including here in South Africa, there's a major transition of the structure of the population, such that in South Africa, for example, the population, the number of adolescents is around the peak that it's ever going to be, and it's going to start declining in a little while. But actually, in South Africa, not for quite a while. Globally, it'll start declining around now-ish. In terms of the number of adolescents and youth in the world population. In, for example, India, it's going to decline dramatically over the next, and China over the next 20 years. Whereas in sub-Saharan Africa as a whole, it's the only part of the world that's going to continue to increase in the number of adolescents up until about 2050. But also the epidemiological transition, that the importance of NCDs, mental health, etc., the decreasing importance of infectious diseases, etc. Thirdly, that there's increasing evidence that interventions in adolescents and in young people, can work and provide an excellent return on investment, and I'll show you some evidence for that in a moment. And fourthly, if you like, there's a social imperative that the development of human capital is going to depend on having a well-educated, healthy, motivated youth moving into adulthood, with hence, if like, reduced dependency and an increased contribution to society, which will end up with greater wealth as well for the country as a whole. So, basic duty of governments and a human rights imperative. They have a right to information and services to promote their health, education, safety and protection. We know that that's not enough, just having it out there, the information, that one's got to also bring lots of motivation to actually do things about that, and to give the skills to be able to make good decisions. But at a minimum, they have a right to information. And also, it's really, I think it's true, we saw a little bit on the data on the investment, global investment, where they've got a big burden of disease, well, relatively big burden of disease, less than obviously very young children, less than very old people, but they've got a relatively big burden, and they've largely been neglected. And that's, I think, generally because they're not yet in powerful positions to advocate for themselves yet, or to make sure that they get the resources. But on the other hand, they're not cuddly little babies who everybody wants to help and to support. So in terms of the demographic and epidemiological transition, yeah, they are actually a large group. And I'm going to go into that in a little bit more detail with an increasing proportion of the global disease. So there are about 8.1 billion people in the world at the moment. And roughly 15%, 1.2 billion of them are adolescents. And then there's another 600 million young adults, 20 to 24. So if one includes all the young people, 10 to 24 years old, that's where the 1.8 billion that is mentioned in the campaign comes from. And that makes up almost a quarter of the world's population currently. If one looks at the numbers, this is I mentioned this earlier, but going into this in a little bit more detail, globally, now is the time when there's going to be the most. If you look at that's 2020, the green things at the bottom, and the line that's green with the yellow dots at the top is between 2020 to 2030 to 2040 is when the peak will turn globally. As I say, in Southern Africa, Sub-Saharan Africa as a whole, it's going to continue to increase beyond that. But globally, this is when there's the maximum number in the world. So where do they live, the 10 to 24-year-olds? And where will they live in 2050? So if you look there, in most of the world, the number of young people is going to decrease. So in North America, in Europe, in Asia and the Middle East, in Oceania, that's Australia and New Zealand and places, and Pacific Islands. But in Africa, it's going to increase. In Latin America and the Caribbean, it's going to be roughly the same, up to 2050. Turning to health and the measure of mortality, the point of this and the next graph is that, as you can see, in low and middle income countries, the mortality rate in 10 to 14-year-olds, 15 to 19-year-olds, and 20 to 24-year-olds is lower than in 1 to 4-year-olds. And of course, if we had infants on here, it would be off the scale. They're much, much higher. But but you can see that it sort of reaches the lowest mortality rate in young adolescents, so 10 to 14-year-olds. And then it starts to climb, and there's a major divergence between males and females, with males having a much higher mortality rate as they get into the young adulthood. And this is largely due to injuries, either from violence or from unintentional injuries. If one now looks at the high-income countries, which of course the pattern is tending towards that, in the low and middle income countries over time, you can see that the mortality rate, especially in males, is way higher in the 20 to 24-year-olds. It's already way higher in the 15 to 19-year-olds than it is in 1 to 4-year-olds. So this makes an important case just on the mortality rates, where we all think, they're not dying much, these adolescents and young, because we're all focusing on the young children. Again, if we had infants here, it would be way, way higher. But 1 to 4-year-old mortality is about, in males, in high-income countries, is about less than half, well less than half the mortality rate now in 20 to 24-year-olds. So clearly, we must remember that adolescents are not all the same. There's particularly vulnerable adolescents, and then there are others. And I've listed some of the examples of many that we could have there. But we also need to remember, that the importance, as I tried to stress earlier, of adolescent health and of interventions to promote that, is much more than just the prevention of immediate death and illness. Thirdly, increasing evidence that interventions in this age group can work. I don't have time to go into the thousands of potential interventions, many of which have been shown to be effective. But just to guide people towards, if you're not already aware. Back in 2017, I think it was, the first edition of this thing, the global AHA, as it was called, Accelerated Action for the Health of Adolescents, was published, which has tried to provide guidance to support country implementation. So it was a menu of known effective interventions for adolescents, particularly related to the health sector, but going beyond that as well in terms of promotion of adolescent health. For countries to select from, and a process that they could go through to decide, what they should be really investing in or increasing their investment in related to adolescent health, and it's spilled into well-being. And the second edition of that came out, I think it was in October last year, which broadens it still further from the first edition to cover areas of social protection and connectedness improvement, education, and so forth. So I recommend you to look there for the details, because I won't have time to do it here. This is, I think, quite a powerful argument for investing in adolescents, and that's the returns on investment. So here in the table at the bottom, you can see the domain, so education, etc., skills, employability, safety in a supportive environment, and health. Just examples from those three domains, which is where the majority of the evidence is. There's relatively little evidence in terms of the returns on your investment related to connectedness and that area, and very little related to agency and resilience. The studies just haven't been done, of the costs and the effects. But you can see that in this model that was developed by Peter Sheehan and colleagues at the Vices Institute, sounds terrible, doesn't it? You've got lots of vices, but anyway, it's Victoria Institute for Social Economic Studies or something like that. What you've got here on the right-hand side is the benefit to cost ratio. So this is for every dollar that you invest, how much does society get back, from that investment in terms of dollars, hard dollars, through, for example, the taxation, the earnings of that individual later in life, the fact that they're not needing to go to hospital and using up, if you like, resources, they're not needing unemployment benefit, etc. All of those things factored into the model. And you can see that, for all these are obviously selected interventions, the effective ones, so excluding, if you like, interventions which have been shown not to be effective. You can see that you're getting returns. This is the adolescent health services, for example, that's a big package of interventions, something like 30 different adolescent health services. But even there, you're getting roughly just under $10 for every dollar that you invest in those. And for some of the specific things like mental health promotion interventions, the estimate comes out at $24 for every dollar that you invest in adolescents. And interestingly, your returns on investment in the model comes out greater if you are investing in low-income countries, where there's more benefit to gain, if you like, from each dollar that you invest, than in lower middle-income countries, than in upper middle-income countries. They didn't look at high-income countries. And the costs of inaction are massive. And in the models that they've done, they estimate that if relative to making some of these known cost-effective interventions, what you're foregoing in terms of your GDP, and they estimate that you will forego, by between now and 2035, 6% of total GDP. By not investing in the scale-up of these kind of interventions to cover 80% of the adolescents globally. Averaging vast amounts of money. I didn't even know what a trillion was. I'd heard about it, but apparently it's a million. And so it's a lot of money, more than I'll ever see. And so, then fourthly, there's the social imperative. the importance of contributing to future human capital, which is obviously linked to your return on investment, but also, if you like, reduced dependency and the potential for adolescents to contribute more to society. And clearly, adolescents do need support. We all know that if we've all been adolescents. We knew that we don't like to admit it when we were adolescents. In fact, we hate admitting that we need any support from anybody, especially from our parents. But we do. And it's partly, if you like, that the adolescent brain is still developing at that stage, so guidance and support is needed. And we're evolutionary and programmed basically for exploration and risk taking, and so we need to get some guidance from people. But they're also, as we all know, those of us who work with them or have them as young people, they're a really potent force for development. Or of course for unrest. Who are the people who are throwing those Molotov cocktails or whatever? They're usually not my age. And then the concept, if you like, of the triple dividend is really important in terms of justifying why we need to invest in adolescents. First of all, because of having healthy and happy and productive adolescents now, but also healthy, active and productive adults in the future. And it spills over into the next generation and even potentially further future generations. Okay, so what's happening now after that introduction, in terms of trying to put adolescents and their well-being center stage, which they have absolutely not been and currently are not, but trying to move it so that adolescents are given more priority and their well-being. So, first of all, what's going to be needed? Well, we're clearly going to need substantially increased investment in the evidence-based interventions. We're going to need multi-sectoral programming across all those 5 domains of adolescent well-being. If we only invest, for example, in adolescent health or nutrition, yes, we will get benefit, but potentially by investing across the 5 domains, we'll get synergies and we'll actually get a much better return on our investment. And then we're going to need meaningful engagement of adolescents. And for those of you who haven't already come across it, a few years ago, there was a global consensus statement that was coordinated about what do we mean by meaningful adolescent and youth engagement. I don't have time now, as I said, to go into some of these details, but I recommend that you have a look at that and see what you think of it in terms of the advice that's there. And thinking about, have we got youth in decision-making spaces? So almost a quarter of the world's adult population are aged, and here I'm extending it, in the 20s. But 2.6% of the world's parliamentarians, are under 30. I was amazed that it was that much, actually. But I think it's a few countries that make a contribution to that. There are countries where there's none, under 30. So they're clearly not there in the final decision-making bodies. And therefore, in order to make sure that their voice is heard, special steps are going to need to be taken in order to hear what they want, for these parliamentarians to actually hear what they want and to give them a voice. And this whole sort of thing of nothing about us without us clearly is not happening for adolescents. So we're going to try and have to think, how are we going to make that more of a reality? Just to re-emphasize that, if you like, there's the adolescent in the center of this diagram and their well-being, the 5 domains that contribute to it, and the reason why, if you like, it's like a jigsaw puzzle is to emphasize that they're interconnected and they will interact with each other. And then around them, there's the family and peers, the schools and community, their local environment, and the wider society. And so in order to put them center stage, we have to think about them as well within their broader context and how that's influencing them. And so turning to last year, early last year, I think it was, or the year before, late, this campaign was started at the 1.8 billion Young People for Change campaign. And that campaign is coordinated by the Partnership for Maternal, Newborn and Child Health. And its aims are primarily to give some voice to adolescents and young people, but also to get commitments from national governments and others to actually increase their investment in adolescents and young people. And behind that, the kind of stuff that I've been working on with colleagues is some of the, if you like, the technical supporting documents, if you like, evidence, if you like, behind that, mainly in two particular areas. But first of all, one of the things that happened was that there was a survey done where it was an online survey put out there with one question, which was just in order to promote your adolescent, promote your well-being. In order to promote my well-being, I want, and then young people just added whatever they wanted to after that, I want. And so the What the Young People Want survey, and by October, we'd had 1.2 million young people had responded to that online, and now actually it's up to 1.5 million. This is the breakdown by the domains that they were particularly asking for. And you can see that by far the largest number of what they wanted related to their learning, their competence, their skills and education and employability. And so that, as I mentioned earlier, that was borne out by this, that being employed, having is incredibly important to these young people. And then safety in a supportive environment, that's a mixture of, if you like, physical safety, sexual safety, etc., emotional safety. And then good health and optimal nutrition, just under fifth. Connectedness, so their relationships came out as 13%, and agency and resilience 6%. So here's a couple of quotes. Being able to walk in the street without worrying about my safety is what's important to me, and a chance to finish school. Am I still on? Is anybody up?
It's opened a different set of slides, I think, for us.
Can you see the What Young People Want slide?
No, it says Delft Annual AOP Report, financial year 2023.
Oh dear, something just funny. I tried not to touch anything. I didn't think I did.
I think maybe stop sharing and then reshare.
Are we still sharing slides?
The slides are gone now.
It's not actually allowing.
You share anymore.
Chanel, we're going to just leave and come back in.
Has it gone out of the web, I think? I think it's gone off the Wi-Fi.
No, it wasn't on
No?
the Wi-Fi before.
Okay.
So sorry about this.
Maybe we leave and go back in.
Yeah, let's just do that.
Yeah. Can you hear me? Is anybody out there?
Yes, we can hear you.
We can hear you.
ET phone home.
We can hear and see you.
Excellent. Okay, so I'm trying to share the slides again.
Yes.
You can see your screen, Prof.
You can see?
You can just do this.
Okay,
Yes.
so can you see a slide now that says Global Forum for Adolescents?
Yes.
Yes.
Excellent. Okay, so one of the initiatives within this...
Just run the slides. The slide.
Yeah.
There we go. Thanks, Prof.
Okay, so one of the initiatives within this 1.8 billion campaign, Young People for Change campaign, was a global forum for adolescents, which was held on the 10th and 11th of October last year, which was a virtual conference-like thing. We had over 5,000 people attending over the 2 days, and more since then, because it's available, all the sessions are available online. I'm going to just see whether this works. If it doesn't, you'll, I hope, get the slides afterwards, and you can see, have a look at...
This is our time.
It's not going to work? It's not sharing? Okay.
I can't see the video, Prof. Just
Okay,
the-
no problem. Then I'll move on to the next one. Okay. So anyway, you'll get the link and you'll be able to look at that afterwards. And at the Global Forum, there were announcements of 20 commitments that were made, 18 by national governments and 2 by intergovernmental agencies. So the European Commission and the African Union made it. You can see that the majority were actually from Africa, which is nice. And they varied in terms of their specifics, but they all involved, if like, we're going to put more effort into, or we're going to invest more money into, or both, aspects of adolescent well-being. Linked to the thing, and I think this is a wonderful thing, and we should do this in every conference, every major initiative for young people, in my opinion, is to have this. There was this Art for Wellbeing competition. I think the whole thing cost under $10,000. Giving out prizes to, the top prize was $1,000 for somebody, which of course for a young person, is a huge amount of money to get. So a very attractive prize. And there were 3 categories: design, film, and music. And over 700 entries came in from 114 countries, and some of the stuff is just brilliant. And as I say, if you commission somebody to make a film, one film will cost you that. Whereas this way, you get all these designs and so forth, and the young people love it because they get some publicity from it. People can vote, all that kind of thing. So that was great, I think. And then out of the Global Forum also, there was an agenda for action for adolescents, which is guiding the adolescent-related work of the Partnership for Maternal, Newborn and Child Health over the next 5 years. It has 7 key asks, if you like, action asks. So the first relates to education. The second to health and well-being services. So that's both, if you like, health services, but also things like safety and the social protection type stuff as well. And then mental well-being and resilience, getting rid of and reforming harmful and punitive laws. So, for example, there's a big debate about not necessarily legalizing, but not making it a criminal offence to use various psychoactive drugs. It still potentially remains a criminal offence to push them or to promote them or whatever. But that kind of thing, is that a harm? Is it because you end up with lots of adolescents who've already got a criminal record by the time that they're 20, and through that, should that be reformed? Those kind of issues. And then social protection policies, preventing stigma and discrimination, and strengthening the agency of adolescents and youth, including, if you like, meaningful adolescent and youth engagement issues. Related to this, there's been a fair bit of technical guidance work, and this is where I've particularly been working on. So I've already mentioned the Global AHA, the second edition of that was led by my colleague Valentina Baltag, who some of you will know at in the WHO. And then this, I've already mentioned, if you like, the case for investment. This is the report, well, the executive summary of the report, which came out in time for the global the Global Forum for Adolescence last October, and yeah, so this is the, if you like, particularly focuses on the economic case for investment, but the case for investment in adolescence, and the final version of the full report will be launched at the World Health Assembly in May this year. And then there's a lot of work going on the measurement of adolescent well-being. So what do we mean by adolescent well-being? Well, we've tried to come out with that with the conceptual framework and so forth, but then how do you measure it as a country? And in fact, South Africa will be one of 3 countries, we hope, where the national case for investment will be done, and also over the next few months, and also working on with local partners in government and so forth on what would it look like in terms of measuring adolescent well-being at the national level, looking into the future. There's a second Lancet Commission on adolescent health and well-being. The first one was published in, I think it was 2016. And this one, the aim is that it'll primarily be looking into action, so what has been done, what's worked, and that kind of thing. The report's due out mid this year. And I've talked for 45 minutes, so much too long, but that leaves us a little bit of time, and thanks for your attention.
Still sharing.
Yeah.
Is this? Yeah.
Maybe
we can just go ahead.
Anyway.
Can we go ahead with some questions? Does anyone have any questions they'd like to ask? You can type in the chat.
Stunned you into silence.
Type in the chat, or feel free to just unmute and ask.
So my question is, why is the number of adolescents going to increase in Africa whilst the rest of the world is decreasing?
Right. Yeah. So it's basically the number. Obviously, is the balance between the number, if you like, the fertility rate, 10 years ago, right, relative to mortality rate until you end up surviving into 10 years. And so Africa, sub-Saharan Africa, is the only region of the world where fertility rates are still, they're not increasing necessarily, but because as soon as, if you like, so if each couple, I know that in South Africa that's a rare event, but anyway, each couple has 4 children, right? Then and the mortality rate, let's assume it's 0. Then the next generation, there's 4 people rather than just 2. Yeah. And so it compounds itself, the fertility in terms of the total number keeps going up dramatically. In the past, a long time ago, the mortality compensated for that. So the total population didn't increase very much because the mortality rates, especially in childhood, was just so high. That's that part of it. But so now the mortality rates are falling, quite substantially in sub-Saharan Africa. The fertility rates have not fallen fast enough, and they will. The projections are that they will, but you also have to remember that there's the lag, because a kid that's born 10 years ago is now becoming an adolescent. Yeah, so that's why.
We have one question online. Dr. Nyosulu, do you want to ask your question?
Yes, mine, I'm not sure whether it's a question or a comment, which I would like you, David, to comment. One thing that I would say that I'm also very passionate about adolescents, and one thing that I have observed is lack of sort of like mentorship and inspiration. You know, adolescents are, you've actually indicated in your framework that the purpose is for them to be supported to reach their maximum potential. And they are going through different, challenges or environments or circumstances, which I would say each one of us have experienced it somehow, somewhere. So for example, you're talking of a Juliet Nyasuru or a David Ross, who went through that adolescence, but he managed to go through, I would say, all of us seated here, I think we are about 60 something. We went through that, but somehow it has been a success for us to be able to listen to this presentation. It means that somehow we've reached our maximum potential, or we are towards reaching our maximum potential. So we managed to go through that successfully. But what have we done to motivate and inspire similar adolescents going through the same environment where we've gone through, be it in our primary schools or those of us who are coming from rural communities, from our rural areas? What is happening there? Because what I've learned is that when I go back to my rural area is that there's a lot of support through UNICEF, whatsoever, but it's more like it's coming to them, but they really don't know that they can go through that the way I went through, and now I'm here, a senior lecturer at Stellenbosch University. So my question is, how much is being invested in that to encourage the grown-up adolescents to go back and inspire those who are still going through that for them to reach their maximum potential?
Excellent points. And I guess, in short, not enough. And that's, if you like, why this campaign is out there, to try and motivate more attention being given to that. As I said earlier, adolescents on their own can achieve some of their own advocacy, and they are a very potent force. If all of us who've worked with adolescents, we know that if you provide the right catalyst and environment for them to really contribute and get out there and do things, they can make a huge contribution. But on their own, they're not going to do it. In my opinion, they're going to need that support, from adults, because they're largely neglected. They themselves, of course, are very busy. They've got lots of schooling and training later on and that kind of thing to get on with. But then, of course, so do adults. They've got to earn a living and all that kind of stuff. But they're not yet in the powerful positions, and so they're going to need people to advocate for them and to provide those skills and the mentorship and the support, to be able to really get their voice heard out there and to make their contribution. So and as I said, everybody wants to try and help the little baby, because I've got my own grandson now, they're cuddly, they're nice, you want to support them. The grumpy adolescent who, all right, I'm being grossly oversimplistic, but not everybody's wanting to support them, but they need that support and they need that advocacy, and they have huge potential, as we all know. But thank you very much for your comments.
Thank you. Mark, I think you had a question. Can you just speak up a little bit?
Okay, yeah, just sort of two quick questions, David. The one is, when it was the paper or the deliberations, but it was universal secondary education. were there discussions about putting the word quality in, because just that issue, and then the second issue is in terms of shifting the way in which young people get meaningful engagement. One of the things that I think should happen is that children from the age of 12, adolescents at the age of 12, should be given the vote. So, kind of, what do you think about that?
Yeah.
Or younger, but 12, let's start. 12 now.
Okay, so quality of education. Actually, I took out a slide because of timing on that, but there's been a very good increase, if you like, in coverage of education, including in sub-Saharan Africa, with universal primary education becoming widespread in government policies around, including in Africa, and increasingly, access to secondary education has gone up, but results have not necessarily improved. And there's a real problem with quality in much of sub-Saharan Africa. I think some of the clearest studies that have been done on that are here in South Africa about the very low quality of education. So just getting them in the school, just getting them in the school does protect them from various harms and does lead to better outcomes in young people, even if the education is actually very low quality. However, to be able to compete in the global world, the quality of education is going to need to be reasonably good or very good. And there's been some recent studies that UNESCO have put out where the proportions of 10-year-olds, for example, who can read and understand a very simple sentence is horrifically low. I won't give you a figure, but it's really a relatively small proportion of 10-year-olds, and in some countries it's a very small proportion, this one included, and that actually got worse during the COVID pandemic, and so clearly concentrating on bums on seats in schools is not going to be enough. It will help, but because it keeps them off the streets, if you like, and keeps them in a social environment where they're getting some support and supervision and stuff like that. But their quality is going to be so important. And now with globally, if you like, unskilled labor is going to become a small proportion of the population will be able to be employed in unskilled labor. And so unless you have skilled people, your country's not going to do well in the near future. So that depends on the quality as well as the bums on the seats. And then in terms of the age of voting, there has been a little bit of progress of bringing the age down, mainly in high-income countries. But most countries, it's now high-income countries, it's 18. It's nowhere near 12. And very few politicians are up for it in terms of bringing the age down. In particular, in general, right-wing politicians are very much against it, because young people tend to vote more left-wing. And so when you've got a right-wing government, there's not even going to be a discussion about it. And even it's quite tricky. It's difficult to convince people that 16-year-olds even have the capacity to make informed choices, because if you're a right-wing politician, I'm the only one who knows anyway. So in terms of you've got to be like me in order to be able to make informed decisions. So I think currently it's a losing battle, except in some high-income countries, to bring it down below 18. And there's some which are. I don't know if any country has actually legislated for 16 plus.
New Zealand.
Maybe, I think there's one or two maximum that have legislated for 16 plus.
The Nordics or something.
Yeah.
We have 5 or so minutes left. Sorry.
I just have 2 comments. The one was just if you could give a tiny bit more detail to what that agency and resilience section
looks like, what are the sort of characteristics or features of that category.
Yeah.
And then the other thing was just if you could speak a tiny bit about that big divergence in the stats, the gendered breakdown of those stats there.
In mortality.
Yeah.
Yeah.
And what that conversation looked like. I mean, just for context and full disclosure, my mum works in HIV and has been working for a long time to talk about the situation for men in South Africa around violence, but also around looking at the slides.
Yeah.
I want to keep talking.
No, go. I'm listening. I'm listening. Yeah.
Gotcha. So it's just something that is not always very, for good reason, understandable reasons, not always very popular to talk about. And I'm just curious if that sort of rose to the top of any of the discussions and whether or not there was a conversation around that. Because in the same way that teenagers aren't cuddly, neither are, kids, young boys who are worth our attention and who become young men who are suddenly not worth our attention. So that sort of.
Yeah. So, and on the slide here, you can see the subdomains for agency and resilience. So, so agency is basically defined as your confidence, if you like. It relates to your confidence to be able to do something. Yeah. So, for example, to know where you're confident that you know where to get a condom. And that you can get that condom so lots of factors come into that. It's not only knowledge and having the information, it's also the availability of the service, but there's also the whole sort of societal pressures and family pressures and so forth to be able to actually access that. So that's the sort of the issue of agency. And then resilience is your ability to bounce back and to cope with adversity. Just to make sure that we're all on the same page. So those issues, but then also, if you like, your personal identity. So including, if you like, your what we put in under this, it could have gone elsewhere potentially a bit, but your sexual identity, your social identity, your personal identity, the feeling of fulfillment is there as well, and also I think this is actually really quite important to many young people, a sense of purpose and the sort of hope for the future that goes into this kind of domain. This is the domain that has by far the least evidence for interventions, and on the other hand, everybody knows that it's important, and that to the well-being of us, these kind of issues are incredible, including for an adolescent. But in terms of evidence of effectiveness, evidence of return on investment, almost no data for many of these interventions. So anybody who's interested in doing research in that area, it's a virgin field.
I noticed that it was also rated the lowest here on the slide, actually.
Yes.
In terms of what people saying that they want.
Yes, but I think that's actually that's really interesting, because if you actually have a meeting, with youth, that comes out very highly. I think it's partly, if you like, the context in which it was asked about. So and also the terminology. I then was explaining what we mean by agency and resilience. And okay, this was all analysed by machine learning, artificial intelligence, by the words that are used. So they didn't have to say agency and resilience to end up in the agency. But on the other hand, expressing that, so it could have been sort of being listened to, or being able to cope. I think it's less likely to get said, if you like, in that. So we've got to be a little bit careful in the interpretation of that. So turning to sort of young men, 1 minute, 1 minute for young men. Okay. I think that young women and women in general, if you like, get much less part of the cake related to a lot of things, including in low and middle income countries, education, especially some, In high-income countries, it's the opposite way around. More young women finish tertiary education now. Young men, in terms of health, do much worse on almost everything except sexual and reproductive health and related things like gender-based violence and so forth. So I think we have to be careful in our thinking about gender and a bit nuanced and a bit thoughtful about it. Whereas, yes, young men clearly do worse on various things, but that's usually ignored. To be honest, on the other hand, young women definitely do much worse, in certain areas, and overall in terms of power, wealth, etc. We all know that it goes in the opposite direction. But I think we have to be careful in our thinking. And this, for example, the slide that you've got up there, and I could get up here if I. With mortality rates by age and sex in high-income countries is really quite striking to many people. They don't think, and it is largely, again, everybody thinks that young women are probably the main victims of violence. No, young men are the main victims of violence. They're also the main, almost the 90-something% of the perpetrators. But so we have to actually look at the data and think about it.
Intersectionally too, right? Thinking about the age of these young men and also the socioeconomic context and the global power dynamics affecting young men in Africa particularly, right? So, well, thank you.
Thank you.
Great. I'm so sorry we're going to have to close off here. Thank you, David, so much for such an engaging presentation. And I believe Chanel's posted details in the chat that the recordings of these seminars are available on the Global Health Department website. So thanks again. We look forward to the next webinar, and thanks for spending your time and your afternoon with us today.
Thank you.
Bye.